Hello, and welcome to the Stem Cell Healing Institute podcast. In case you have any questions regarding this program, please write us at info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Welcome back to the Stem Cell Healing Institute podcast. We are here with Dr. Sarah Figueredo. She is the research and technical director of the Institute. How are you, doctor?
Hello, I'm very well, Louise. Thank you so much. How are you?
I'm doing great. We are doing this podcast because I know a lot of people are concerned about COPD, which is the chronic obstructive pulmonary disease. Doctor, what can you tell us about COPD?
Yeah, well, COPD can come in a couple of several different forms. We're finding that also post-COVID, patients are coming down with COPD due to lung tissue breakdown and scarring after COVID. And other forms of COPD include emphysema, which is usually caused by smoking or secondhand smoke, as well as inhalation of noxious chemicals or substances like asbestos, silica, things like that. And then chronic can also be fall under the umbrella of COPD as well. So that's what we talk about. And now, where stem cells are concerned, we can literally go in there with stem cells and regenerate the damaged tissue. So what tends to happen, for instance, with something like emphysema, the surface area of the lungs have been decreased because we have something in our lungs, little sacs that fill up with air for us to be able to breathe and absorb oxygen. Those alveoli, they're called alveoli. These alveoli literally break down. So the surface area of the lungs have been decreased to such a great degree that these types of patients, emphysema, bronchitis, any type of COPD, they tend to have problems with oxygen saturation. And that's why they tend to usually have to, at some point, be on some sort of oxygen at what it could be during the day or when they sleep, or some type of oxygen machine or tank or concentrator in order to allow them to saturate their tissues better with oxygen.
So, can we say that this also works for asthma patients?
Oh, yes, absolutely. So asthma is, it can help. What we do with asthma is that we do, again, with the whole comprehensive stem cell treatment, we do everything that'll address the asthma or emphysema or chronic bronchitis or asbestos inhalation with the detox, all the vitamins and minerals, as well as the oxygen, the exercise with oxygen, and or hyperbaric chamber, and the growth hormone, as well as the stem cell enhancement formula. So yes, with asthma, it's a little bit different because there tends to be this chronic inflammation, but it's addressed very readily with stem cells.
Doctor, I always ask you what are the symptoms of any disease that you treat? What would be the symptoms in this case?
Yes, so it comes down to difficulty breathing, and what that means really is that there's either inflammation where the airways are narrowed, or it can be what I described with emphysema and with asbestos and things like
Coughing?
coughing.
Yeah.
Yes, coughing. There's coughing. There's because there's a diminished supply of oxygen, or at least the amount that's being absorbed into the lungs, the oxygen exchange. There is yes, so they're always under the feeling of a suffocation because they just can't get enough oxygen. into their body. So yes, coughing, difficulty breathing, those types of symptoms, and then panic because they feel like they're suffocating.
Yeah, I heard also this disease is very common in big cities, right? Where there's a lot of pollution, like Mexico
Pollution.
City.
That's right. That's right, Louise. Yes. So we see emphysema and all different types of COPDs very readily in developing countries. We see it a lot because of the fact that the air quality is not really regulated. So in North America we have air care and things like that. Yeah, in developing countries we don't. So we see it a lot in those types of countries.
What will be the time after the stem cells are applied that the patient will start feeling better?
Oh goodness. So we see results sometimes within days. Usually we want to give it a good rule of thumb is 3 to 6 months where you may even just start to see a change or at least really, really good change, a good amount of change. Um, and we apply the stem cells not only IV but also directly with a nebulizer, along with things like glutathione and things that really really help as an antioxidant, which really really helps uh, with the lung tissue. So we combine our cocktails very uniquely in order to have the best possible effect for whichever organ we're trying to address.
And for after COVID or COVID sequela, will be the same treatment, doctor?
Yes, so we depends on what we're seeing. So on imaging, what we are looking for is any kind of scarring, any kind of damage, whatever damage it may be to the lung tissue, a breakdown of the lung tissue, the scarring, uh, diminished surface area. So we address everything in a unique fashion in order to have the best possible results.
So, doctor, I know I asked you this before, but in this case, what will be the whole process of deploying these stem cells?
Yes. So as we've discussed before, but for new listeners, we always like to reiterate how the treatment works. After screening of the patient, before the patient comes to Guatemala for treatment, we start a pre-treatment protocol with key nutrients and supplements and some key dietary changes, very sustainable, nothing that will be the scare a patient away. And then once the patient gets to Guatemala, we can do a continued pre-treatment, including a total detox program of nutritional IV, with different B vitamins and different vitamins and minerals, along with the suppository and B vitamin shots. And then we also follow that up with growth hormone, age appropriate growth hormone therapy, as well as oxygen therapy, which again can be in the form of exercise with oxygen therapy or hyperbaric chamber, depending on the limitations of the patient, as well as a stem cell enhancement formula, which contains key minerals and herbs to just nudge the stem cells along. And this is all to create an environment in the body for the best possible um, milieu for the stem cells to just prosper and for them to do their ultimate work.
I see. And can this disease develop any heart diseases in case it's not treated right away?
Oh, yes, very good question, Louise. So what can happen is when the lungs are taxed and we're not getting enough oxygen, the heart has to work harder in order to for the rest of the body to get oxygen. And so we tend to see, in many cases, congestive heart failure. We can see other types of myocardial pathologies, which are the diseases of the heart muscle, and yes, so it can definitely have an effect on the heart.
And also the brain. You may also get a stroke if you don't get enough oxygen on your brain, right, doctor?
That's right. Or if the proper blood flow
Uh-huh.
to the brain, we can have hypoxic conditions, and it can result in some, some forms of brain damage. Absolutely.
Yeah, this is something for smokers or even secondhand smokers. Is that correct?
That's right. That's right. It actually, secondhand smoke has been shown to be even worse than firsthand smoke, because the second, the bystander does not have a filter, where this actual smoker has a filter, so it tends to be worse
Oh,
for the
yeah, that
bystander.
makes sense for sure.
So in the later stages of COPD, because we tend to see issues with heart, we tend to see, and that results in somewhat of a congestive heart failure. It can be. We see swelling of the feet. We see a lot of fatigue because the heart is just not pumping well, and getting and also the fact that there's not enough oxygen in the body. So we tend to see fatigue and swelling of the feet, and eventually weight loss, and it just that's in the later stages of COPD.
I see. Um, does the oxygen therapy will be only the EPOC one? How
Or the EWAT.
the EWAT? I'm sorry.
That's okay. Yes, that would be, well, it depends on the patient. So if the patient finds it too difficult to ride a bike for 20 minutes at a moderate pace, because perhaps the emphysema or the bronchitis may kick in and they just can't get their heart rate up. In that case, we will use a hyperbaric chamber where they lay in the chamber for 90 minutes. Most patients prefer the exercise with oxygen, the EWAT, because it's only 20 minutes on a stationary bike. But again, because of limitations of certain patients, we offer both. We offer both options, which makes it very, very nice for the patient.
Okay, you did mention that these treatments are done in Guatemala, and why are they done in Guatemala, doctor?
Yes, that's again a very good question. Because of the FDA laws and Health Canada laws that create huge limitations on the scope of stem cell practice in North America, um, we literally can't combine the stem cells with anything else, even your own autologous growth factors, or or exosomes, or any other type of stem cell. It cannot be combined two components, because it was considered an unapproved drug, and that's illegal in the eyes of the FDA and Health Canada. Number one, Health Canada doesn't allow any form of stem cell treatment. There is a version of stem cell treatment in the U.S. that's available, but again, it's with these limitations. So nothing can be combined. The stem cells can't be grown or incubated or expanded in any way in numbers. They can't be manipulated in any way whatsoever, and everything has to come from the patient's own body. So, because of these limitations, the results just aren't there for various types of diseases. So because of that, we are outside of the U.S. and Guatemala. Being in Guatemala allows us to do state of the art, cutting edge treatments, and keeping our prices ethical. So that's why we're in Guatemala.
Okay, and if you come to Guatemala, we can arrange everything, including the transfers from the apartment that we can provide and to
Yeah,
the appointments. Is that correct, doctor?
that's right. So we provide a personal driver for airport transfers, appointments, whatever the patient may need, as well as accommodations with the whole treatment package. So we're very proud to be able to offer that, and make it very easy for the patients.
All right. Anything else you would like to add to this podcast, doctor?
I think maybe just that I think people need to know that Guatemala is a destination country. It's a beautiful country. A lot of people, it's not on the radar as a touristic country, but We have
You know what, doctor? Some people don't even know that Guatemala is the next country next to Mexico.
That's right. Or Costa Rica. That's absolutely right. We're right. We neighbor Mexico as well as Costa Rica. And most people know about Costa Rica, but they don't hear about Guatemala. But I will tell you, Guatemala with the active volcanoes that you can actually climb safely and roast marshmallows in the lava, and as well as coffee farms where so much of Starbucks coffee comes from Guatemala. And then the ruins, there are Mayan ruins, one of them, namely Tikal, where Return of the Jedi, the Star Wars sequel, Return of the Jedi, was actually filmed, or parts of it was. So there's just other, and then Antigua is here in Guatemala, which is a World UNESCO Heritage Site. So just a lot to see. Nobody has ever been disappointed after coming to Guatemala.
That's right. And we can also arrange 1 day tours or weekend tours if you want to go sightseeing. Doctor, I appreciate your time and thank you for answering all my questions. And hopefully, we will hear from the audience in case you have any questions or in case you want to ask something specific to the doctor. You will find all the information how to contact her in a few seconds. Doctor, have a great day.
Thank you so much, Louise. You too. We're almost approaching the weekend. So if we don't talk before, you have a beautiful weekend.
You too, doctor. Bye bye.
All right. Thank you. Bye bye.
If you want to contact us at the Stem Cell Healing Institute or Dr. Sarah Figueredo, you may do it by calling us. In North America, you may dial +1 209 690 7836. Also, if you want to write us by WhatsApp, you may add +502 4220 7297. Please send us an email at info@stemcellhealinginstitute.com. And don't forget to visit our website, stemcellhealinginstitute.com. Also, if you like to recommend our treatments, you may find us on Facebook at Stem Cell Healing Institute. Please follow us on Instagram at StemCellHI. If you want to recommend this podcast, please refer to anchor.fm/stemcellhealing. Also, you may find us with that very same name on Spotify. If you want to watch our videos, please go to Dr. Sarah Figueredo, that is on YouTube. Thank you.